Hello, my name is Tom Stapleton, Executive Director of the Wakefield Community Access Television Station. And today again we have Senator Jason Lewis with us. And I'm looking forward to this conversation because it's been a while since we've been together.
Hey Tom, good to see you, and thanks for having me back.
Oh, it's always a pleasure. I know we have a lot to go over. So let's get right to it. Now, what's the story about the Wakefield High School?
Yeah.
I heard a little rumblings about what's going on with that.
Yes, I'm glad you asked that. That's, I'm sure, a very important topic for everyone in the Wakefield community. Everybody knows that we have the new Galvin Middle School, and that was a very successful project. And the next priority for the community is to rebuild Wakefield High School. The way that school building projects work in Massachusetts is that it's a partnership between the local community and the state school building authority. Okay. And so the process is that the community has to put forward an application and has to get accepted into the school building program. And the challenge is that the school building authority has limited resources, so it's very competitive. But the very exciting news is that out of 70 schools all around the state that put in applications this year to be into the program, Wakefield High School was one of only about 30 that are actually moved on into the next round. So because of that, the Massachusetts School Building Authority came to visit Wakefield High School just this week. Earlier this week, so they met with myself and the other members of our state legislative delegation. Obviously, Superintendent Lyons was there, the principal from the high school, the town administrator Steve Mayo, and various other people, and spent about an hour talking about the concerns about the facility and what the needs are to upgrade the facility, and also then took a tour. And showed the folks from the MSBA what really is going on and what needs to happen. So we're going to continue to advocate as forcefully as we can for the Wakefield High School to be accepted into the program. Okay. If that were to happen, then there's, if that happens, and unfortunately of the 30 schools, maybe only about somewhere between 8 to 12 might be able to be accepted in, again, just based on funding. But we've been working hard to see this happen for a number of years now. And then the process would be that there would be a feasibility study that would be done together between the town and the Mass School Building Authority. And that study would look at all the options for the high school. Renovating the existing building, building a new, completely new building, where that would be built, and looking at it in terms of both the cost effectiveness and meeting the academic requirements for the future. And then there would be approval to move forward with the selected option. And then the Mass School Building Authority would fund, probably the exact amount will be determined, but probably at least half of the cost of the project. Okay. And then the other half would have to be paid for by the community, and so that would probably require a debt override vote at some point down the road. But this is a big step forward. This is big. And so we're going to keep at this, and until we can get the project off the ground. But we're very hopeful.
It's exciting to hear, and I know some of the problems with the high school is it's a possibility, I should say, that they may lose their accreditation because of some of the things that are going on over there, and so this would be a great. Great thing.
It's needed. I mean, the facility is tired and old, and the teachers. I mean, we took the tour, and talking to some of the teachers and the staff, they do an amazing job, because they work around some of the facility limitations, but they do a great job still providing a high quality education. But it makes it more challenging. Obviously, in the science labs, for example, it's harder. And we need to have a modern, world-class facility to provide the best possible education, particularly after the students and families are used to the Galvin, which is such a great facility, and then come here. So that's why this is a priority, and for the legislative delegation, for the school committee, for the town council, and I think for the community. I think there's a lot of support for a new high school.
Well, we all know that you'll be right behind them and making sure that things get done right. So no pressure, though.
Okay.
No pressure. Well, that's great news. Thanks for bringing that up. A couple of questions I want to run by you. I was wondering if you can discuss the minimum wage law and the effect it'll have on businesses and their employees.
Absolutely. So, so you're talking now about some of the things that happened during the legislative session,
Right.
which basically wrapped up at the end of July. And so there was a flurry of legislation, in May, June, July, on some major issues. And one of those, as you rightly point out, has to do with the minimum wage. And I chair the Labor and Workforce Development Committee. I'm the Senate chair, and in fact, the House chair is Representative Paul Broder, who
Right.
many viewers may know, who represents part of Wakefield. So we work very closely together on a lot of labor-related issues. And one of the things we worked on was the minimum wage. There was an effort to actually put that on the ballot to raise the minimum wage. It could have been on the ballot in November when we go to the polls. But there was general agreement that it would be a lot better to try to work this out, with all the stakeholders at the table and not let it go to the ballot. And so Rep. Broder and I were involved in working with the business community and with various advocates and other groups. And so the agreement that was reached, and that is now the law in Massachusetts, is the minimum wage is going to increase from $11 an hour, where it is now, over 5 years to $15 an hour. So that will give us one of the highest minimum wages, which, if you think about the cost of living in this area, there's a good justification for that. But we are phasing it in over 5 years to give businesses, particularly small businesses, time to adjust to that. And there is a lot of evidence that, well, I should say that the estimate is about close to 1 million workers in Massachusetts would benefit and would see an increase in their income because they're they hold a minimum wage job, or maybe right above the minimum wage. So a lot of families stand to benefit, and also a lot of that money that then goes back into their paycheck gets spent in the local economy.
Right.
So it also can help stimulate the local economy as well.
Do you get a feel whether people like it or dislike it, or is it pretty much 50-50?
I mean, I think in general,
think?
everyone recognizes that, people are struggling to get by.
Yeah.
That with the cost of housing, the cost of food and health care and transportation, that it's really hard to make ends meet. And, particularly if you're earning a minimum wage, I mean, a lot of people I know who earn minimum wage, and it's not just teenagers anymore. This is people who are adults who are working. They're having to work 2 jobs.
That's it.
Maybe even 3 jobs. It's really hard. They don't see their kids. And, getting that bump from $11 an hour to 12 or 12 to 13, that makes a huge difference in somebody's life. And they're able to, take better care of their family. Also that some of these families who are earning minimum wage, they have to rely on public benefits. They may have to rely on, mass health to help with their health care. They may have to rely on food stamps to help with food. So when people earn a higher income, they're less reliant on public benefits, which means we save taxpayer dollars. So, there's a lot of arguments here. I understand, on the other hand, some people are concerned about businesses being able to pay the higher wage. And, and I think there's some validity to that argument too for certain kinds of smaller businesses. But overall, as long as we phase it in, I think gradually, and when we see that increased spending in the economy, that is going to help to support a lot of local businesses as well.
Well, speaking of families, the next question I have for you is, a lot of people are being challenged between work and their personal life. How will the paid family medical leave law affect people?
Yeah, that's another really significant new law that we passed back in June. This was also one that I worked on closely with Representative Broder and members of the business community and a lot of advocates and others. And this is something we actually negotiated the details for over a year to get to. That's because having a paid family leave program is very complicated. Who's going to be eligible? What are the criteria for being able to take leave? How long can you take the leave for? How much are you going to be paid? All those kinds of questions. So we reached an agreement, and Governor Baker signed it into law back in late June. And I'm very excited about this because we will be one of now only 6 states that have a statewide guaranteed paid leave program. And it'll function basically like a social insurance program where everybody who's working would pay in to the program. It's not a lot, maybe a few dollars a week.
Yeah.
And small employers will be exempt from paying anything, so we wanted to protect them. And then when you have a new baby, or you maybe adopt a child, or let's say you come down with cancer and you need to have cancer treatment, chemotherapy, or let's say you have a close family member that is going through a serious health issue, you'll be able to take time off work. Your job will still be protected, so you don't have to lose your job.
Yeah.
And you will get paid, not your full salary, but you get partial wage replacement for while you're on leave. So what this really means is now you're going to have hundreds of thousands more people who will have access to paid leave, who would today not be able to take it. They'd have a baby and they really can't take time off work to bond with their baby, or they have a serious illness and they either have to just leave their job altogether, or they have to somehow struggle through because people can't afford to go without any pay, or their job's at risk if they take leave. So this is going to make a big difference for a lot of working families.
Well, it sounds pretty good to me, and I know that the people who can take advantage of this will feel a lot better.
Absolutely.
That their job's still going to be there.
Jobs protected.
Yeah.
And there's a lot of protections in the law against abuse, because some people worry about, are people just going to take advantage of this? And there's a lot of protections, and people have to, it has to be an actual documented medical condition, or you have to present the birth certificate for the child to be able to qualify for the leave, and there's going to be auditing to make sure. But for people that really need this, be able to take this time off work, and obviously the duration is limited, it's a certain amount of time.
Yeah.
That is going to really help a lot of people, and so I think it's an important new program for Massachusetts families, and will help. I think it'll also help a lot of our small businesses, because large companies often can provide this benefit already, but small businesses typically can't afford to provide it, so they're not on a level playing field. Now, because this will be available to everyone, smaller businesses won't be at a disadvantage relative to big companies. A person who wants to go to work might say, I can't go work for the small company because I need paid leave benefits, so I'm going to go to a big company. That won't be the case anymore.
Well, that's good to hear. Kind of jump around here a little bit. As you know, the high-tech industry is booming here in Massachusetts. And a lot of companies are asking employees to sign non-compete laws. Can you tell us a little bit about the reforms made to the non-compete laws?
Definitely. This is another major new step forward, I think, for workers in Massachusetts. And this is something that I took a personal interest in, because before I ran for the legislature, I worked in the high-tech industry. And so I've seen firsthand how companies make their employees sign non-competition agreements. And basically, for those who are not familiar with them, what it says is, it prevents an employee from going to work for another company that is considered a competitor with that company for, it can be for 6 months, can be for 2 years. And so, that can mean people are in a position where they can't really earn a living. And it used to be it was only for certain, highly paid workers who would have to sign these non-compete agreements, and then it was really more in the tech industry. And now it's expanded, and we see examples of people who work in sub shops, having to sign these agreements, and camp counselors, and crazy stuff that more and more companies are using these. Basically prevents their workers from moving to other companies. And so I think they're really unfair, and they really hurt people. So we've been working for years now to try to reform our non-compete law. And personally, I'd rather get rid of it altogether, but that was not possible. But we did reform them, and now what that means is there's low-wage workers will no longer be subject to any kind of non-compete agreements. And for higher income workers, there's going to be a number of protections in place now, so that it can't be longer than a certain period. And while they are not able to work, they will receive partial wage replacement, which will make a big difference. So there's a number of good new things now that will help a lot of workers in Massachusetts.
There again, some progress made there in that area.
Yeah.
The next thing I want to talk about is very concerning to me, and I'm sure a lot of other people. Vaping. It's a $1 billion business now, and and it's affecting the youth as well as other people too. But you know, a lot of people are very concerned about it. So,
Yeah.
Can you tell us about the tobacco vaping law that was signed this year?
Absolutely, and this is another area that I do a lot of work in, is in public health, because I am the chair of two committees in the state Senate. One is the Labor Committee we talked about.
Yeah.
The other is the Public Health Committee. So this is an issue I've been very involved in, working closely with groups like you know, the Wakefield Coalition for you know, to prevent
Wake Up
substance abuse, for Wake Up, and you know, working with our schools, and you know, it's good news that use of you know, cigarette smoking has gone down among teenagers, but the bad news is that vaping, which is the use of electronic cigarettes, which is just another way to deliver nicotine, you know, has skyrocketed. I mean, there are surveys now that show more than a quarter, maybe even a third of high school students are at least experimenting with vaping. And the products like the Juuls are, you know, you would never even know it's an electronic cigarette. They look like thumb drives. And the company markets them in all these flavors, you know, like mango and cool and mint and cotton candy.
Idea what kind of chemicals are they?
You have no idea. They're not really.
knows?
They're not fully regulated by the FDA.
Yeah.
You don't know about all the chemicals in it. They have very can have very high concentrations of nicotine. Very addictive. So it's a big problem with kids. And the new law that we passed, which was actually my bill, is going to require anyone who to purchase any tobacco product, including vaping products, to be 21 years old.
Right.
So that's going to help prevent teen use. And then secondly, it defines for the first time vaping as a tobacco product. So like here in Wakefield High School, or in you know, in any public buildings or any restaurants, wherever you can't use tobacco, smoke cigarettes, you wouldn't be able to vape either.
Yeah.
So that's going to make clear that clear that confusion up.
Well, you know, it's a huge problem, and some of the schools apparently people are using the restrooms to do their vaping, you know, in between classes and so on like that. And some of the younger kids, or some of the children, what I call them children because they are, but are afraid to go into the restrooms for fear that they may get caught, even though they're not doing any vaping. So it's a difficult situation.
Yeah.
I know the schools are doing their best to control this and so on. But,
well, it is, and you know, this new law will help. But really, what we need is more education and prevention in the community to help parents to understand what these products are, and that they're not for teenagers, and to help kids understand, you know, whether it's vaping, whether it's alcohol, marijuana, you know, obviously opioids, that those are not things that they should use when they're a kid. You know, some of these things, when you're an adult, you can make your own decisions, but not when you're a teenager. So a lot more education and prevention, just like what Wake Up is doing in the community. I mean, I was just taking a look at some amazing videos. They're like public service announcements that the kids made themselves, and they're for other kids and also for parents. Particularly about vaping. On vaping.
Yes,
and that's exactly what we need more of, you know, to help. It's a really focus on education and prevention.
I mean, it's just so many distractions now for young people today. It's truly amazing. It's truly amazing.
I wouldn't want to go back to being a teenager. I don't know about you, Tom, but it's tough. I've got two daughters that are teens, and there's a lot of challenges they face.
They got to stay right with them.
Yeah.
You know, because it doesn't take much to make a bad decision.
Yeah.
Speaking of bad decisions, what about the opioid crisis? How's that going?
Yeah, so you know, it continues to be a major battle. You know, we still are experiencing too many deaths from overdoses. You know, a lot of those are heroin mixed with fentanyl, which is a very powerful drug, and we're trying to crack down as much as we can on the trafficking of fentanyl. But we did pass another new law, another bill this session to build on what we've previously done around opioid education, prevention, treatment, and recovery. You know, the fact is that the scientific research and the medical research is showing us conclusively that drug addiction is a disease. It's a chronic mental illness, and so we have to treat it that way, which means because it is a chronic illness, you can do things to prevent it, And that's back to what
Yeah.
we were talking about, education and prevention in our schools and communities. And this new law provides more funding to do that. Second thing is treatment. You know, people can and need treatment, and we've been adding more treatment beds and more programs. We've been doing a lot to reduce the number of prescriptions that are, you know, extra pills that are in circulation, and provide take-back programs and things like that. And then the third piece is you need to support people in recovery, because it's a chronic illness. You're never completely cured, but you have to help people to stay safe and sober. So that's where recovery coaches and recovery programs come in. And something I'm excited about, we, in the most recent state budget earlier this year, we added some new funding within the Department of Public Health to open 5 new recovery centers in Massachusetts. There's currently 10 of these centers, but there's not one in our area. And these are centers that are run typically by people in recovery themselves, long-term recovery, and they don't provide medical care, but they provide counseling groups, they provide job trainings and job resume support so people can get back into the workforce. They provide, you know, other health services, wellness programs, you know, hobbies.
Yeah.
It's a way for people to come together and stay engaged and not be at risk of going back to using. And so the good news is, because of this new funding, we're going to be able to hopefully put in an application to open a recovery center in Malden.
Wow.
And we have a
That'd be
whole
good.
team there
Yeah.
that's working on this, and they have the support of the mayor, the police chief, they have support from surrounding communities, including Wakefield. So if we're successful in getting this open, which I'm very optimistic, that will be a new resource available for people from the whole region who are struggling with addiction, and are in recovery, and we want to keep them from relapsing.
That's good news,
Yeah.
too. And
That would help a lot
it's a
of people.
difficult subject, there's no question about it, but to have people who have been involved and were users, and now they're not, and they would know more than anybody
Right.
what other people are going through.
That's
So,
right.
That's a good
That
sign.
personal experience is
Yeah.
a way to really, that's very effective in helping people.
Well, this last question that I want to ask you is very dear to my heart, but you were a leading advocate for the Massachusetts Alzheimer's and Dementia Act. How does the new law support people affected
Yeah.
by Alzheimer's disease and dementia?
Yes, indeed. I've long recognized, as have many people, that we've got a major public health crisis on our hands, which is the growing numbers of people with Alzheimer's and other kinds of dementia. It takes a devastating toll on the families. It takes it's a huge cost for our healthcare system. You know, and the estimates of the number of people that are going to have Alzheimer's in the years to come, and the amount of healthcare costs that's going to account for is just overwhelming. So it's clear we need to take stronger steps. The new law that we passed, we had a signing ceremony a few months ago with Governor Baker. We worked very closely with the Alzheimer's Association, and they were very helpful in this. Also, the AARP was very involved. And the Mass Medical Society. But this new law is, first of all, is going to require the creation of a state plan. So right now we have a lot of different programs and services, but now we're going to have one coordinated plan that is going to require all of the different efforts we have underway in the healthcare system, in the nonprofit sector, in the state government, local, to all be, you know, sort of better coordinated. Then we're going to require better and increased training for healthcare providers and for elder service workers to identify when somebody is in the early stages of Alzheimer's. Because one of the things I've learned, which is really surprising, is how infrequently people who have Alzheimer's are actually diagnosed, and even when they're diagnosed, how often they are not told, or their family is not told,
Really?
that they have Alzheimer's.
Wow.
That was very surprising to me to learn that. And there are various reasons for that.
Yeah,
But this new law is going to change that, because it's going to improve identification, diagnosis of the illness, and is going to then require, while respecting healthcare privacy laws, is going to require that people know what their diagnosis is, because although there's no cure or treatment, there are steps you can take to better manage the illness, and we want families to be able to do that. So that's an important new piece of this law as well. And then there's some other things to help caregivers and generally provide better support and treatment.
Well, again, that's a step in the right direction, and as you said, it's a disease that is going to affect a number of people down the road, and I don't know exactly the amount, but it's staggering from what I hear.
It's a huge number, and we have to get ahead of it.
Have to do something
And
about
the
it.
good news is, I was told by the Alzheimer's Association of Massachusetts after the law passed, they said that they're getting calls from all over the country about this, because apparently this is really a leading edge, and a lot of other states are now looking at what we did here in Massachusetts and saying, we want to follow your lead and do something similar.
Well, so we're not just sitting down on our fannies here, we're getting things done.
That's right, Tom. There's a lot of work to do, and we're pretty busy.
So we have a few minutes left. Is there anything else that you'd like to run by us a little bit? Couple of minutes left.
We're going to continue. We talked about, obviously, the high school at the
Yeah.
beginning of the show, and that's an important priority for me and for the other members of our state delegation, Representative Broder and Representative Wong. We're also going to continue to try to support as much as we can the Wakefield, Main Streets Initiative and the
Okay, yeah.
downtown, that everybody's really focused on trying to encourage a vibrant downtown, increase the number of businesses, restaurants, and the Albion Cultural Exchange is a good example of that, with bringing sort of culture in. And I was pleased we were able to get some funding, an earmark in the state budget for the Albion Cultural Exchange
That
to
was quite a
continue
bit,
to.
wasn't it?
Yeah, I think it was about $100,000
Yeah, that's
that
what I
we
thought.
secured for that, and so that's these are all efforts aimed at trying to continue to revitalize the downtown. There's something called the Complete Streets program that Wakefield is moving along to being accepted into, and that's going to generate some additional state funding to help with improving sidewalks,
That's important, yeah.
crosswalks,
Yeah.
and just making the downtown more walkable, just safer for pedestrians, particularly people who are elderly or pushing strollers. And again, that supports, there's a lot of evidence that supports the local businesses, because people then are comfortable coming to the downtown, getting out of their cars, shopping, dining. That's going to be, I think, a real asset to the whole community.
It sounds like all good stuff, and I know we're running out of time now, but I really do appreciate you coming by and giving us an update on things, and hopefully another month or so or two we can get together again and go over.
You bet.
The next step.
My pleasure.
All right.
Thanks
Thanks
for
for that
having
good
me.
news about the high school.
Yep. Well, we're not quite there yet, but
Yeah,
this
well,
is
it's
an
encouraging,
important
yeah.
step forward.
Yeah.
So we'll
Okay.
keep at it.
Thank you very much, and thank you for listening, and we'll talk to you later. Bye now.